Hi, it's me, Dr. Kristine Kiat, and I'm here to offer you a new video. And today's topic is going to be about speech delay. Are you worried that your child can only say a few words? Is your 3-year-old communicating with you with signs and gestures, but he or she has only a few words in his or her vocabulary? Should you be worried? It may very well be that your child is normal and maybe a late bloomer and eventually will be talking to you nonstop, but it is also possible that your child may have some speech delay. So I urge you to keep watching to learn more about it, okay? So, speech delay. In this video, I'm going to talk about the normal language development of kids, like what milestones they reach at what age. And also, we're going to discuss what signs you need to look out for and in which you need to worry if your child is already exhibiting some speech delay. And also, lastly, we are going to talk about tips on what you can do at home to help your child, develop his or her language. So, communication and language in children. It starts around 1.5 months when your baby would be smiling in response to your face or to your voice. And then around 6 months, they start to babble like, yeah, 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 like that. Around 7 months, they can follow one step command with gesture. For example, you point at them and say sit down, and then they would sit. Around 10 months, they can also follow the same one step command now without gesture. So simply by saying sit down, your child would sit. Around 10 months also, they would start saying mama or dada. And around this time as well, they would be able to point at objects like baby, pointed at their doll, or light. Around 1 year or 12 months, you would be able to speak their first real word. Around 15 months, there would be more words, like 4 to 6 words already. And then later, 18 months, more words still, about 10 to 15 words. And then 19 months, they would start speaking 2-word sentences like mommy, shoe. Alright, back to the 12 to 18 month period. The infants usually respond to simple statements like no or bye bye. They know what that would mean. And around 15 months is when the average child would be able to point to major body parts like eyes, mouth, head, and they can use 4 to 6 words spontaneously and correctly. Around this time as well, they would have what we call the polysyllabic jargoning, where, for example, they have a book and they would say, yeah, yeah, da, 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 do. They would just be doing that, and they don't seem to mind even if you don't understand them. All right, now for the 18 to 24 month period. So, around 18 months, your child can say 10 to 15 words. And around 2 years, they would have more, 50 to 100 words already. After they have about 50 words in their vocabulary, they would try to make simple sentences already. And also, around this time, they can follow 2-step commands. For example, give me the ball and get your shoes. They could follow that. And then we move on to the 2 to 5 years of age. Their vocabulary just increases to more than 2,000 already. For a 2-year-old, they can say about 50 words and they speak 2 and 3-word sentences. For example, mommy, no, something like that. And also, around this time, you can understand half of what they're saying already. Around 3 years old, they get better. They speak in 3 to 4-word sentences, and you can understand 75% of what they are saying. Around 4 years old, they get really good. You can understand all of what they're saying 100%. They can count to 4, and they also use the past tense. 5 years old, they can use the future tense already. So what I just pointed out are Are your child's developmental milestones in language? If your child has not met those milestones, it is possible that he or she might have some speech delay. It is also important to note, though, that children develop at their own rate, and your child may just be a late bloomer and still be normal. So, next, we're going to talk about signs of speech delay that you should watch out for. Alright, so when your child has speech delay, it doesn't mean that there is anything wrong with your child. It may just mean like he or she has a different timetable for speech and will be able to catch up soon. So, what are the signs of speech delay that you should watch out for? In 12 months, when he or she is not using any gestures. And then around 18 months, when they prefer to use gestures rather than vocalizing or talking or making those words. And in around 18 months, and if they also have trouble imitating sounds. Around 2 years old, you need to worry if they do not use 25 words, they can only imitate speech or actions. If they do not follow directions, simple directions, and if they have this weird tone, unusual tone in their voice. Around 2.5 years, you need to worry if they do not use two-word phrases or noun-verb combinations like mommy shoe or daddy play. And in a 3-year-old, you need to worry if they do not have at least 200 words, if they do not ask things by their name, and if they're hard to understand. And at any age, if they're not able to say their previously learned words. So as a clue, in a 2-year-old, you can understand 50% or half of what they're saying. In a 3-year-old, you should be able to understand 75% of what they're saying. And in a 4-year-old, you should understand all of what they're saying already, or 100%. And now, we will differentiate speech versus language. In a speech delay, your child may try to speak some words or phrases, but it's hard for them to understand. And then, in contrast to language delay, where they form words well, you can understand what words they're saying, but they do not combine it to form simple phrases. That is a language delay. So, a reason for the speech delay might be if your child has problems with the mouth, with the tongue, and the palate. An example would be tongue-tied or ankyloglossia. A clue would be when your child was an infant, he or she would have trouble breastfeeding. Also, another clue is that your child might have trouble pronouncing the following letters: the D, L, R, S, T, Z, and TH. Another reason for the speech delay might be hearing loss. So, if your child cannot hear words or he just hears distorted sounds, will not be able to form words or phrases. So, a clue would be if a child does not acknowledge a person or an object if you name them, but if you use gestures, the child would acknowledge that person. Another reason might be from lack of stimulation. So these are children who have been abused or neglected, or simply if there's lack of stimulation or nobody engages with them or talks to them. Obviously, if no one talks to you, you would have trouble developing your speech and language. And another reason for the speech delay might be if neurological problems would lead to having your child having trouble with the muscles for speech. So an example would be from cerebral palsy, muscular dystrophy, and traumatic brain injury. And lastly, a reason for the speech delay might be if your child has autism spectrum disorder. Signs that your child might have it is, for example, if there's repetitive behavior, like doing the same action over and over again, or if there's repetitive speech or echolalia, where the child repeats the same word over and over again. Another thing, if there's impaired social interaction, or if there's lack of eye contact, and if there is a regression in speech and language, and if there's lack of verbal and nonverbal communication. So those are the signs you watch out for autism spectrum disorder. Diagnosing speech delay. So it is challenging to diagnose speech delay. And also, in 10 to 20% of 2-year-olds are late bloomers or late to develop speech and language. And it is also more common in males, 3 times more likely seen. And mostly children with speech delay do not have a speech or language disorder and are caught up by 3 years of age. So what happens? First, you bring your child to your doctor, and then the doctor will examine your kid and interview the parents and other caregivers. And depending on the results of the examination, your doctor might decide to refer your child to a speech therapist or to an audiologist to check for hearing loss. And if there is a muscle or neurologic problem, your child might be referred to a neurologist and possibly also referred to an early intervention. Now, I offer you tips on what you can do at home to help your child develop his or her speech and language. So, first off, talk directly to your child. And when you do this, try to narrate what you're doing. So, for example, the mother in the picture can tell your child, I am eating a bowl of soup and it feels warm in my tongue. Another thing you can do is you use gestures and try to point at objects. For example, look at the frog. You can also do this with body parts like head, eyes, nose, mouth. You can also use colors, or you can do this with other things. And of course, it is important to read to your child. You can start reading to your kid even when he or she is still a baby. And it's important to read to them as toddlers. So for example, in this picture, the mom is reading to her kid, looking at the pictures as they go. You can also sing simple songs that are easy to repeat, like this mom using an instrument also. Also, be patient when your toddler is talking and give them your full attention. Give them a chance also to say those words, even if you can anticipate what they're trying to say. And also repeat the words correctly rather than trying to criticize them for their errors. Also, let them interact with other kids, especially those kids who are older or have a more developed speech and language. And so, what do you do when you think your child has delay? So you need not worry, because most of the time there is nothing wrong with your kid and he or she will be talking nonstop soon. But it can also be a sign that there is an underlying problem, like there might be hearing loss or developmental delay. So talk to your doctor about it. And in the meantime, I encourage you to keep talking, reading, and engaging with your kid to develop his or her language. Alright, that's the end. I hope you enjoyed the video. Thank you.
Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?